A feared second wave of the COVID-19 pandemic is striking the Midwest. Hospitals in the region report 90% occupancy or higher, and many hospital workers are falling ill with the virus, further stretching resources. Joining us now with an update on this critical problem is Dr. David Herman, CEO of the Essentia Health System, and Dr. Andrew Thompson is an infectious disease specialist with St. Luke's Hospital. And doctors, thank you both for being with us. We really appreciate you coming in during this challenging time for your facilities and for yourselves. Dr. Herman, let's start with you. How is Essentia and its facilities doing right now in terms of the coronavirus and addressing the current surge?
We are very busy. We are very busy with patients with coronavirus in regular hospital beds and in the ICU. And of course, the ordinary burden of illness continues here as well. So we're seeing patients with strokes, heart attacks, trauma as well. We are incredibly busy.
And what about you, Dr. Thompson?
We're having the same issues that Essentia is. Really, for the past month or so, we've been quite busy just with typically ill patients, patients who may have deferred care from earlier in the year, but we've been busy. On top of that, we're seeing a significant increase in numbers of COVID patients. And as you mentioned earlier, we're finding ourselves in some departments short-staffed due to staff becoming ill as well.
Is that the case at Essentia too?
Yes, it is. And the challenge that we have is that staff are contracting the virus or being exposed to the virus within the community. So today we had more than 400 care providers just here in the east part of Essentia that were unavailable to work in their clinical activities.
Good or bad, a lot of people are skeptical of COVID-19 and of the numbers. People hear about record numbers of patients hospitalized with COVID. Are the folks within that number actually hospitalized due to COVID, or is it a situation where people come in for other things, they are diagnosed with COVID, and then they fall into that category?
No, these are patients that were diagnosed with COVID, usually by a COVID test and an illness outside of the hospital setting, have been managed at outpatients for a while, but now have gotten seriously ill and end up being in the hospital.
We have one ICU completely devoted to COVID patients. These are patients on breathing machines. They're critically ill. So COVID patients are admitted to the hospital to care for their COVID illness. It is very real. If you saw what I see on a daily basis, you wouldn't doubt it.
So your opinion that it's not, the spike is not due to increased testing, it's actually due to more people getting ill with COVID?
Yes, it's due to more people getting ill. Even with the increased testing, the number of patients testing positive is incredibly high. But as Dr. Thompson said, on the regular hospital beds and in the ICU beds, we're seeing more COVID patients than we've seen before.
Dr. Thompson, with so much stress on the capacity at St. Luke's and all the facilities around here, what should people do if they think that they have COVID? Should they show up at the emergency room? Should they come in to their doctor? What's your recommendation?
Good question. People should get tested. If they feel ill, they should seek out care. They may want to call their primary doctor to get guidance. At St. Luke's, we have a respiratory illness clinic. So if people are concerned and they have symptoms, they could go to that clinic up at Miller Creek. I know Essentia has the same. And there's also testing available in the community. People may be aware that at the deck in Duluth here, there's free testing for all Minnesotans. So if people are concerned that they've been exposed or that they're ill, they should get tested. And once they're tested, they should isolate until they have that result. That's a critical part of it. It's not just getting tested, it's also protecting everyone around you.
Dr. Herman, why do you think the spike is occurring right now? Is it because more people are indoors and their gatherings are indoors, or what do you attribute that to?
I think so. There's a lot of different reasons. First of all, we are indoors more often than we were. I also think our behaviors have changed over the last several months. There's a thing called pandemic fatigue. You just get tired of that. We're all human. We like to be in contact with others. Schools have started back up. Our young people have gone back to the universities and back to schools. I just don't think we're doing as good a job as we did in the summer, masking, staying away from each other, and avoiding gatherings.
Any best practices that you would recommend for people as we head into the winter season and as we head into the holidays when so many people get together?
I agree with Dr. Herman. We're tired. We're fatigued. You know, we, as in Minnesota, starting in March, we really buckled down in the springtime, and I think we prevented a lot of illness. It's hard to see that because we prevented it. We have to keep doing those things that we did back in the spring. We have to mask. We have to avoid gatherings. We have to really not be unmasked except around people in your household, unless you're at a significant distance from them. Those are the key factors to prevent transmission.
Governors in both Minnesota and Wisconsin have issued mandates and or recommendations as we head into the holidays. Do you think that's a solid step at this point in time?
I would say the approaches that both governors have taken have been very data-driven approaches. We know where people get the virus. We know how they spread it. And so the recommendations that they've made and the rulings that they've made should help in helping tamp this down.
How optimistic are you as healthcare professionals that this is going to be gotten under control pretty soon? We had Pfizer come out earlier this week with an announcement that there's a vaccine that has apparently a 90% success rate. Do you see this as a good sign within the next year that we might have this under control?
I think you've got the time frame pretty much right. We know that the allocation that the state of Minnesota is going to get for the first vaccine is about 100,000 vaccines. And there's a group in the state that's working towards how those vaccines will be allocated. I think everybody in the region right now has an opportunity to be a healthcare hero. And that's by doing, as Dr. Thompson said, masking, avoiding gatherings, and I would add, get your flu shot.
And what about you in terms of your optimism for the future?
I'm not optimistic about the next few months. It's going to be very difficult. It's going to be difficult for all of us, for healthcare workers. It's going to be really hard on families. It's going to be hard to miss those holidays, to miss Thanksgiving and Christmas and New Year's. But I think in the long term, in the next 6 to 12 months, we have a lot of tools that are going to help us get this under control. I think there's light at the end of the tunnel, but the tunnel is still long.
We have about 15 seconds left, so strongest argument right now. What do you want to get out to people?
Wear your mask, maintain that social distance. This is an opportunity for us to use our behaviors to get this under control. We can't wait for the vaccine.
Dr. Herman, Dr. Thompson.
Do all of those things, and remember, it's to protect those people around you, your loved ones, your community, your neighbors. Let's all get through this safely.
All right. Thank you for the good advice, and thank you for the work that you and your crews are doing to keep everybody safe.
Thank you very much.